Okay guys, this week's craniofacial tip, we're talking about how to improve opening. So sometimes when you have a lack of opening, it's called trismus or lockjaw. So today I'm working at improving opening, and my patient here had some cancer on his left side. He had to have it removed and they put a flap in. So as a result, he had to have his jaw kind of shut for a period of time, and so we're working on regaining opening. And so he does wear dentures, and one thing we're going to use the tongue depressors to improve opening. We leave the dentures in because we can actually stretch it a bit more aggressively. And so now you'll notice he has a little mini massager. So if you see this here, this is something I've had before. It's a left side that's mostly restricted, so he actually will massage kind of under the zygomatic arch, any areas where it's tender, so as it's being stretched, it's less painful. All right, so here are the tongue depressors, and we're going to put them between his teeth here. And what we're going to do is we're just going to slide in a tongue depressor, and of course that each time we put one in, it's going to stretch it. And so we are going to do, I usually count like how many I can do. We did 18, we're gonna do 20 today, but on this particular stretch right here, we're gonna go to 19, okay? So you can see his opening is improving as I slide each one in there, right? You know, just kind of, and this is the best way to stretch the jaw, okay? All right, so he is using the massager there. This is 18 right here. Give him a little bit, try to stay relaxed, try not to tense up, try not to fight it. All right, we'll do one more here. All right, so that's 19. So usually for about a minute, let it stretch the jaw. He's doing the massage on the areas where he can feel that tension, and it works very well. So usually I'll do it about, maybe in a session, I do some prep work. I'll do some internal release of the masseter, loosen up any tender areas internally. Then we'll do some lateral glides right and left to loosen up the joint. I might do some distraction, and then I do the stretching. So this works very well, and then I just kind of document how many I'm doing. I'll say, I did 20 tongue depressors. And so thank you for watching. This is a great technique, and any patients with lockjaw, trismus, or difficulty opening, this is the way to regain the opening. Thanks for watching.